Hello, and welcome to Pharmacist Michael's Happy, Healthy Living. Are you considering hormone replacement therapy to fight your menopausal symptoms? Stay tuned as we explore the benefits and risks of hormone replacement therapy, also known as HRT.
Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
Hormone replacement therapy is really good at helping with the tough symptoms that come with menopause. Menopause is that time in a woman's life when she stops having periods and her body naturally starts making less of certain hormones, especially estrogen and progesterone. This drop in hormones can cause all sorts of issues, both physically and mentally. Some women have a really hard time with these changes, and it can really affect their day-to-day life. That's where HRT can make a big difference. Menopause can bring a whole bunch of different and tricky symptoms. One of the big ones is hot flashes. Imagine suddenly feeling super hot and sweaty, especially around your neck and face. That's a hot flash for you. Then there are night sweats, which are pretty much hot flashes but at night. They can really mess with your sleep, making you feel tired and grumpy. Mood swings are another thing. One minute you're feeling fine, and the next you might feel super down or anxious. It's like being on an emotional roller coaster. Oh, and let's not forget about vaginal dryness. It's not talked about much, but it's common and can make sex uncomfortable or even painful, which obviously isn't great for your sex life or feeling close to your partner. HRT basically helps by giving your body back some of the estrogen and sometimes progesterone that it's missing during menopause. Think of it like topping up your body's hormone levels to help keep things balanced. This can really tone down a lot of those tough menopause symptoms. Many women who go through HRT say they don't get as many hot flashes or night sweats, and they're not as intense as they used to be. This can make a big difference in getting a good night's sleep and just feeling better overall. Another big plus of HRT is that it can help keep your mood more stable. By balancing out those hormone levels, it can cut down on those sudden mood changes and help keep feelings of depression and anxiety in check. This can make everyday life a bit smoother and help in getting along better with people. And for issues like vaginal dryness, HRT is a big help too. It works to keep the vaginal area healthy and stretchy, which means less discomfort, and it can improve things in your sex life and even help with urinary problems. Now, it's important to remember that HRT doesn't work the same for everyone. Some women get a lot of relief, while others might not notice as big of a change. The kind of HRT you use, like estrogen by itself or with progesterone, how much you take, how long you're on it, and how you take it, like pills, skin patches, or gels, can all make a difference in how well it works for you. That's why it's really important to have a treatment plan that's made just for you, based on what you need and what's going on with your health. All right, let's chat about something really important that a lot of people don't know. Estrogen is like a superhero for your bones. You see, estrogen is this hormone that does a ton of stuff in your body, and one of its big roles is keeping your bones strong and healthy. Now, when a woman hits menopause, her body starts making less estrogen, and this can be kind of rough on her bones. This drop in estrogen is why a lot of women after menopause start worrying about osteoporosis. Osteoporosis is when your bones get less dense and more fragile, and this means they can break more easily. No one wants that, right? Well, here's where hormonal replacement therapy, or HRT, comes into the picture. HRT can be a real game changer because it tops up those dwindling estrogen levels. By boosting your estrogen, HRT helps keep your bones dense and strong, just like they need to be. This means you're less likely to get osteoporosis, and less likely to have fractures or broken bones, which is a big win for staying active and healthy as you get older. So in a nutshell, if you're a woman going through menopause and you're thinking about your bone health, which you definitely should be, HRT might be something to consider. It's like giving your bones a bit of extra armor against the effects of losing estrogen. But as always, this is a chat you'll want to have with your doctor to see if it's the right move for you. So here's a bit of interesting information about HRT and heart health. Back in the day, people thought HRT could lower the risk of heart disease, but it turns out it's not that simple. The thing is, whether HRT helps with heart disease really depends on when a woman starts using it. If a woman begins HRT pretty soon after menopause starts, there's a chance it might help in keeping her heart healthier and reduce the risk of heart problems. But, and this is a big but, as time goes on and she gets older, this benefit kind of fades away. Basically, the further you are from the start of menopause, the less HRT does for your heart. So if you're considering HRT and wondering about its effects on your heart, it's really important to think about how long it's been since your menopause started. You know, there's some talk that HRT might have a couple of extra perks, like making your skin a bit more stretchy and helping your muscles work better. But keep in mind, these aren't the main reasons doctors suggest HRT. They're more like nice bonuses. The big reason for going on HRT is usually to deal with those tough menopause symptoms. So while it's cool to think it might give your skin and muscles a little boost, that's not the main thing it's there for. All right, let's talk about one of the big worries when it comes to HRT, the risk of cancer, especially breast cancer. There was this really big study called the Women's Health Initiative, or WHI for short, which focused a lot on women's health issues. What they found was kind of important. Women who were on HRT that combined two hormones, estrogen and progestin, had a bit of an increased risk of getting breast cancer. Now, it's important to know that this increase in risk isn't huge, but it's still something to take seriously. Think of it like this. If you're considering HRT, especially the kind that uses both estrogen and progestin, it's a bit like adding a small risk factor to your health. It doesn't mean you'll definitely get breast cancer, but the chances go up a little compared to if you weren't on this type of HRT. Now let's talk about another important issue discovered during the Women's Health Initiative study. They noticed that HRT might up the chances of having a stroke or getting blood clots. This was especially true for women who were a bit older or who waited a long time after menopause started before they began HRT. So what does this mean if you're thinking about HRT? Well, it's another piece of the puzzle. It's super important to weigh these risks, especially if you're older or it's been a long while since you hit menopause. So there's another thing about HRT that's important to know, especially if you still have your uterus. When you're on HRT, especially the kind that only has estrogen and no progestin, you might have some irregular bleeding. It's not the same for everyone, but it's something to watch out for. And there's one more concern. There's a small increase in the risk of getting endometrial cancer, which is cancer of the lining of the uterus. This risk bump isn't huge, but it's still something to be aware of, especially if you're not taking progestin along with estrogen. Hormone replacement therapy is a really good example of how tricky it can be to make medical choices. There's a lot to think about in terms of what's good about it and what's not so good. For a lot of women, HRT can really make life better during menopause by easing those tough symptoms. But deciding whether to go for HRT isn't a one-size-fits-all thing. It really depends on what's going on with your health, how old you are, and how severe your menopause symptoms are. If you're thinking about HRT, it's super important to have a good, detailed chat with your doctor. You want to make a good choice that's right for you, considering all the pros and cons. Plus, there's always new research coming out about HRT, so what we know about it keeps growing and changing. It's all about staying informed and working closely with your doctor to figure out what's best for your health. If you want more information on medications, nutritional supplements, and other health and wellness topics, be sure to subscribe to our channel. We release 3 videos each week on Monday, Wednesday, and Friday at 9 a.m. Eastern Time. Also, feel free to leave any questions or comments in the comments section of this video. I have also placed links to products that I believe can help you live a happy, healthy life in the description section of this video. My name is Pharmacist Michael. Be happy and be healthy.